you see that? All right, here we go. I hope you can read this. Coping with Cancer magazine. Today is my 9th anniversary of having my left pneumonectomy. What year is this thing? In July of 2016, I was printed in Coping with Cancer magazine. Can you read what it says there, Jean?
I never felt or thought I would not survive. Even during the rough times, I maintained my belief. I still do today.
And
he's a survivor for 9
what's
years.
my name on there?
Garen Petty.
Lorain, Ohio. Anyhow, I was in the Coping with Cancer magazine in 2016. And from 2016, matter of fact, today is November the 28th, 2023. 9 years ago today, I was about halfway through my surgery now. It's 7 or 8 minutes after 12. I don't think I started about 8 o'clock. They started cutting me. And they finished up 3 or 4 o'clock. Anyhow,
4.
I want to thank Dr. Joe LaHora. I'm still alive, Dr. Joe. Katie Peretti is physician's assistant. My wife, especially, for hanging around with me. My brother-in-law, George Schneider. Nieces and nephew, Brian Gillis. Matt Gillis. Monica Gillis and Barb Gillis. Russ and Arlene Gillis. My 2 daughters, Michelle Gibbs, Buster Brown in Florida. She's a UPS driver. And Erica Zagola, who works at the Cleveland Clinic. I had this surgery at Fairview Hospital, part of the Cleveland Clinic. So since 2016, I was trying to get the city of Lorain to acknowledge that November is Lung Cancer Awareness Month. In 2017, the Chronicle, I sent a letter to the Chronicle. And you can see where it says here. You don't have to hold it on there. See what the title of that and show my letter.
I'm trying.
The letter's up here. Anyhow, my letter was printed. And I want to thank the Chronicle for printing that letter, which I don't see anybody else trying to do this stuff. I don't know why it's just me. I guess I just do this stuff. This is like the 5th video I made from about this lung cancer I had. Here's a picture of it. Right there, my whole bronchial tube was plugged up. That's clear. That's on the right side. This is on the left. That's why they had to take out my whole lung. And I gotta say that Zach Simonoff, my friend, was the first one to come visit me. This was December the 5th, 2014. So shout out to Zach. This is the results. That's what my scar looks like on my back. This was November the 30th, 2014. That's how they had to cut me. A lot of times they use what they call VATS, V-A-T-S, video-assisted thoracic surgery. They didn't do that with me. They had to go in the old-fashioned way. They cut me. So, that's why when I first met Dr. Joe, the first thing I said to him was, cut me, Mick. Cut me, Mick. I can't breathe, like Rocky. Rocky. He had the old swelled up eye from fighting Apollo Creed. I made a couple of these videos and I showed exactly this is the right lung, which I still have. My left lung is gone. That's the pulmonary artery that plugged up, and all this stuff is these videos are to help people. I went through this. It's very painful, but it was necessary. They learned a lot from my surgery. when I first asked the doctor, as many of you know, I'm pretty blunt. I asked him, what's my odds? You know, and he says, oh, I can't give you any. Okay, I said, well, then let's just go for it and do what we got to do. I went through some tests, nuclear stress test for my heart. My heart was okay to go through the surgery. And then, I don't know, the surgery was like 6 or 7 hours. I don't know. I was knocked out, right? I was the patient. But after you survive this stuff and you go through chemo, they give you this Purple Heart Award from April 2015. And then the Mole Center at Fairview, I went through, 25 radiations. Those were terrible. And I've previously said that I nicknamed the radiation machine Pac-Man to go like that and eat up all the cancer. Now, it was concentrated here because my cancer was right in here. And when I was done with that, I had like a circle suntan mark on my back. Lung cancer is not a very fun thing to get. The awareness of lung cancer. People want to blame cigarettes for lung cancer because that shows that most of the people that have lung cancer have smoked. There's like 250,000 lung cancer cases a year. 20%, 10 to 20% of those cases are people that never smoked. Okay, so let's stop the blame game and find out the reason. My cancer was called squamous non-small cell. It can grow underneath your fingernails. I don't ever see any fingers smoking. But this stuff can grow anywhere on your body and inside your body, apparently. Now, like I've said before, lung cancer and any disease we get is because our body becomes out of balance. The cells become out of balance. My father died of myelodysplastic syndrome, which means your bone marrow makes your blood cells, your red blood cells. And then if it's on a time release. They release at a certain time when they become mature. If they don't mature and your bone marrow releases it, the white cells attack the immature red blood cells, and that's called myelodysplastic. It's a pre-leukemia. It's because the balance, he lost balance in his how his bone marrow worked. I always call cancers out of balance energies, mutant DNA. It's like, I don't know, how can I say this? It's like okay, I'll use this as an example because we had them on the side of the house this year. We had grubs. Okay, grubs. They're, what is it? The beetles or something. They lay their eggs and the grubs grow, right? And it starts eating the grass from the inside because the grass wasn't strong enough to fend off the invasion of the grubs. So you have to put insecticide on there to kill the grubs. This is what cancer is. It eats from the inside, but squamous will eat from the outside, underneath your fingernails, on your face, wherever it goes. I'm making this video to hopefully tell people and help people become aware of your body. If you're a healthy person, like I was healthy, even though I smoked, and but I played golf for years. I mean, this is 1914. I started playing golf in 1965. Most of the time we walked. When we retired, we all started taking carts. But I noticed I was out of breath playing golf. Man, something ain't right here. I'm out of breath all of a sudden. So naturally, I lit up another cigarette, right? But I went to the doctor. We went to the urgent care, and the doctor says, "Oh, you got an infection or a cold." And I said, "How about a CAT scan?" No, they wouldn't do it. So a month after that, I was coughing up blood and went to the ER, and finally they did a CAT scan, and and they had found the cancer. This is a picture of what when they did the biopsy. At Mercy Hospital. My surgery was done at Fairview Hospital, Cleveland Clinic. It was pretty interesting because after the surgery, they put you on these painkillers, morphine and Dilaudid. Well, I hallucinated from Dilaudid. I called my wife, and my sister brought me some soup. Oh, and I forgot to mention my sister too. She was a great help in this, and my nephew Dave Kovach. My sister brought me some soup, and of course, with the medication still. This is when was this? The night or the day after surgery?
The day of surgery.
The evening of surgery, and I called my wife up. Now, this is what hallucination does. I'm in a hospital room, and I'm dialing the phone number on a touch-tone phone without any lights on. I don't know. I must have the third eye, right? The third eye, remember the three women from Jason and the Argonauts, the third eye. You can see stuff. So I was able to type out, and I called her up. I said, bring me some salt at 10:30 in the morning. Matter of fact, Donna's here visiting.
It was at night.
10:30 at night. Okay, Donna is here visiting Aunt Stella now. She'll get a kick out of this. So Gene and Donna Schulich, they came and brought me some salt. All right. For a couple of days, I'm hallucinating. I didn't know what was going on, right? And finally, they got me straightened out where was allergic to Dilaudid, and the morphine didn't help. So I was in the hospital for what? I think 8 days. Came home. Well, on November the 5th, or December the 5th, Zach Simonoff came to see me. And the 28th, so well, that's only 7 days, ain't it? No, see, the 29th, yeah. 7 days. After that, I had to go back and see I was on oxygen when I came home. I went back to see the doctor a week after that, and for some, I don't know, it was my destiny maybe, but they took me off oxygen. And I've only been on oxygen once or twice since then. Once, I think, when I had pneumonia last year, real bad in this lung. What I'm basically trying to tell everybody is pay attention to your body. If you're going along fine and something, doesn't feel right, or you wake up in the morning, you got a headache, for no reason, and it lasts more than an hour or whatever, maybe you should go get checked out. Me, I think I waited too long because I noticed the shortness of breath I was having probably for 3 months before I went to the doctor finally. So I was stubborn. Now I'm not stubborn anymore. Any little change, I'll go to the ER and try to get help, whether it's medication, them viral pills or bacterial. That's what they're there for. The doctors are there pretty much to help you. But you've got to be able to tell them what's wrong with you. You can't just go in there and say, well, I got a headache. Well, how long has your headache been going on? Did it happen all of a sudden? Did you crack your head? Is it just, came out of nowhere? That's what you have to pay attention to. So this is what this video is about. I want to thank the mayor of Lorain and the city council for making November Lung Cancer Awareness Month. We like to honor this group of people, that group of people. October is Breast Cancer Month. And I know ladies go through a lot of pain when they get breast cancer. Men can also get breast cancer. I don't know why or how. It gets out of balance. Your body gets out of balance. The blood, your muscles hurt, or something bothers you. You have to go get checked out. That's pretty much all there is. I don't want to go into this other stuff, but when I had to do my radiation, I read this book, Radiation Therapy. I mean, it can't tell you what it does. With the pain factor, it only tells you how it works. You know, to get rid of if there's any cancer. And also, I have this from COPD from Cleveland Clinic. I notice when my symptoms start, try to breathe or take my rescue. What's that thing called?
Inhaler.
The rescue inhaler. You got to pay attention to your body. You got to pay attention to yourself. When things change, if you get a sore throat from out of nowhere, you know, and it lasts a couple of days, maybe you should go get it checked out. Maybe you have, you know, I don't know what, but you could have something. In the 9 years since I had the surgery, I've had COVID. I've had 2 or 3 times, of pneumonia. I think 2. The first time I had it was in spring of 2020. And I asked my pulmonologist, this was in March or January I had it, I think. In April I asked her if I had COVID, because that's when COVID came out, and she said they weren't even checking for COVID back then. But, you know, whether it was COVID or not, I've only tested positive for COVID once, and that was last year. I can tell right away when I'm starting to get sick, because it's like, you know, I'm trying to breathe hard. I'm laboring to breathe, and I don't let it go for more than a day, and I go to the ER to find out I might need a, you know, antiviral or antibacterial medication. But that's what I'm saying. This is mostly about awareness. Be aware. Be aware of your body changes. Smoking might trigger some of the things, but then non-smoking, what triggers, you know, cancer if you never smoked, okay? Those of us who lived in South Lorraine, we grew up in a smelly steel mill with the open hearth and orange smoke, and there's all kinds of stuff blowing around, coal and dust, and there's still carbon monoxide that we're breathing and everything else. So all this stuff is, it's a miracle that humanity has survived with all the stuff we breathe now. But that's what I'm saying. Again, I want to thank Dr. LaHora and my wife, my family that stuck by me with this. I try to make people aware of my situation. I don't wish it on anybody. I hope that people live a healthy life. I hope the medical science can figure out a way to stop this stuff. If they haven't already, you know, let's save humanity from some of the things that happen. But then somebody like me that went through this helps the doctors learn how to help the next person down the go 10 years, 20 years. So that's what I want to say. Thank you to everybody. Today's the 9th anniversary. Go by one lung, because I never paid attention to my lungs. And when I lost that left lung, I had to start taking care of this right lung. See, that's a nice breath. I mean, you don't know how good it feels to be able to breathe like that. 14 years ago, when I was trying to breathe, I could feel like my air was stopping right here, because this is where my lung cancer was, in that bronchial tube. And Dr. LaHora, it was, I think it's funny now, but Dr. LaHora, a couple of days after the lung surgery, he came into my room. He said, the surgery went fine, and, you know, I'm still breathing and that. He says, but I got to tell you this. He says, you know, they took out 20 lymph nodes from around the area where the left lung was. There's 2 lobes on the left lung. They took them both out. And he says, he put his head down. He says, we took 20 lymph nodes and froze them, and then they biopsied them. And he says, I have to tell you, there was 8. 8 were metastasized with cancer. So I just put my head down, looked at him, I said, well, that's better than 9, right? And he started laughing. And that's when he told me he thought I would make it. And so here I am, 9 years later, I made it, you know. But I'm just saying, for people, pay attention to your body. The medical science is wonderful nowadays. I don't see very many videos on YouTube where they do it the way that they cut me in my back. They do this VATS, video assisted thoracic surgery now. They put 3 little holes in you, one for the camera and 2 for the knives and whatever and they deflate your lung and they pull it out through there. But this is what's interesting. I hope everybody watches this and just pay attention to yourself. We never know when we're going to get a disease or we become out of balance. Anyhow, I want to thank everybody for watching this and just pay attention. Because if you can catch this earlier, if I knew the symptoms then, 10 years ago like I do now, I may not have had to go through all this. They could have probably done it with chemo and radiation or with medication. Anyhow, I love you all. And
And I want to just say, I hope the doctors listen to also when the patient tells them what they think might be wrong.
Oh, yeah. A doctor to me should be like a mechanic. You drive your car every day or your truck every day, you know, and then all of a sudden you're starting to hear something funny going on or some noise that wasn't normal. When you go into a mechanic, you tell them the symptoms. And that's what I think doctors should do. When you tell the doctor the symptom, they should be able to diagnose what could be the cause. So shout out to all the doctors. Pay attention. Be good, you know, listen, be still and listen, you know, what people are telling you. Anyhow, again, I love my wife very much, and I thank you for taking this video. So we're going to say hi to Jean. Hi, sweetheart.
Hello.
Okay, this is it. I'm out.